We do treat many athletes, whether it be high school or college athletes. We are organizing everything to include the therapist and the trainer so we're all on the same page, maximizing their time in sport, minimizing their time away from sport, but doing it in a safe way that doesn't cause any long-term problems with the joint is our goal and our focus.
When I was in my residency, we took care of the Knicks, the Jets, and the Rangers, so I had the opportunity to be on the sidelines for those professional teams and seeing how we handle those, which is not undifferent than maybe treating the adolescent athlete to the middle-aged athlete to the elder athlete.
We'll start with non-invasive conservative measures typically, which include physical therapy, sometimes short courses of medications, activity restriction, so we can rebalance soft tissue and muscle forces, whether it be the shoulder, the knee, the hip, the back. Common scenario in the clinic is a high school athlete coming in, whether it be soccer, basketball, football, pivoted their knee, they felt a pop, they had pain, they end up having an ACL tear. This is a difficult problem for the high school athlete because of the amount of time it does take to recover. The risks of an ACL tear of continuing to participate in sport with a dysfunctional or non-functional ACL, it does put their meniscus, which is a shock absorber in the knee, and their cartilage at risk of future injury. They're going to require surgery for ACL reconstruction. And what that looks like is about a 2-hour surgery. They're outpatient surgeries, meaning they go home the same day, but there's an intensive rehab period after that. And depending on the type of graft we use for the ACL reconstruction, depending on other injuries they may have of the meniscus and cartilage at the time of surgery, recoveries are usually 6 to 12 months as it relates to return to play.
We have a great talk about, okay, this is what surgery looks like for you. It is a big, big sacrifice. It is definitely something I don't ever want to underestimate in their mind.
My particular practice in sports medicine involves both upper and lower extremity care. A large part of my patient population have shoulder issues. That deals with non-surgical and surgical care of the shoulders.
We understand that we're in the people business, and trying to help people through this process is a big thing that I think we do very well.
The biggest thing I would say that can help a patient recover is commitment to doing the exercises that the physical therapist will give them. It's frequent and often, and it at times can be difficult and painful, but in order to move better, we have to move.
The aging athlete needs to be aware of everything that they've done prior in their life that may contribute to how they respond to activities now.
Yeah, so the aging athlete does present unique challenges, and as the population gets older and patients want to remain active, they have more problems, particularly with their rotator cuff and sometimes with their knee and the meniscus. It has to do with just the aging of their soft tissues. Oftentimes their problems can be taken care of with physical therapy and a short period of activity restriction. Sometimes they require an escalation of care to include injections, and then only in reluctant or recalcitrant cases, surgery.